via the chat box. So again, all lines are muted today, so please use the chat box to pose your questions. And I apologize for the delay, but we'll get started right away. Connie, let me turn it over to you.
Thank you, Christine, and thanks for helping through all of the technical issues we were having. You did a marvelous job. So today's an exciting webinar for all of us. It is Understanding the New Mandates and Regulations, and what I've done is skinnied our original presentation down to only the new mandates and regulations. So I do want you all to know that this presentation is a joint sharing commitment between Access, Health Current, the Board of Pharmacy, and the Arizona Department of Health Services. What we'll cover today are the EPCS regulations and mandates, a little tiny bit about where Arizona versus the national landscape. I'll talk a little bit about the Controlled Substance PMP, Prescription Monitoring Program, what the mandate is and how to access it. Also talk about the Click for Control campaign resources, and I'll give you some hints on benefits of EPCS, which might help you with your prescribers to better understand why they really need to do this, because we all don't like change. Okay, let's get right into the regulations. Just the background. In 2010, the DEA, Department of Drug Enforcement, permitted pharmacies to receive, dispense, and archive electronic prescriptions for controlled substances. And in April of 2012, Arizona's then Governor Napolitano signed into law the legislation making it legal in Arizona. And then in 2019, Governor Ducey signed the Arizona Opioid Epidemic Act, which also mandated the EPCS for all Schedule II controlled substances that are opioids. And then in February of 2020, Governor Ducey signed House Bill 2075 that cleaned up a lot of the issues with the original EPC prescribing mandates. So let's take a look at what we have to do today. So for House Bill 2075, it extended the EPCS deadline for Schedule IIs to January 1, 2020, and it is for all prescribers in all counties. If you'll remember, the original mandate was for the larger practices to be live by January 1, 2019, the smaller ones by July 1, 2020. So, 2019. So what it did was it removed the waiver. We have no more waivers. Everybody in the state of Arizona that's going to electronically prescribe needs to be capable to do so by January 1, 2020. And please know, I have been told over and over, there will be no additional exemptions or mandates. So also there are some requirements for compounding that we're working on. So specific Schedule II substances for direct administration, there's some ruling around it we'll talk about. Also, it clarified special circumstances and procedures for when the systems were down, when the pharmacy system or the prescriber system, which was not in the original bill. And also, it confirmed that veterinarians no longer needed to do EPCS until the state board of veterinarians can tell us that there's enough software out there to do it. So veterinarians are off the hook for the time being. At the bottom of the slide and all other slides where it's necessary, I've put a link for you to the actual House Bill 2075 and also any of our information that's on our website. So you'll be able to go there and find the information. The other mandates within the 2075, which is very interesting and very exciting because it wasn't in the original bill, so we didn't really know what was going to happen. So you can write and fax a Schedule II controlled substance that is an opioid if it is written for in Arizona to be filled outside Arizona, you can write it. For medication that requires compounding 2 or more ingredients, you can write it for the time being. For medication that is not in the e-prescribing database, so in other words, if you have a brand new medication, if it's not in the database, you may write and fax it. And also for MAT, for medication-assisted treatment that is for a substance use disorder, can also be written and faxed.
Question, Connie. Does HB 2075 require benzols to be, I apologize there, be prescribed as well, or just opioids?
It states that it is opioids and bens, but I believe they're working on the bens. What I will do is research that question for you and get back to you, because there's some gray, cloudy areas around it, and I want to make sure that I'm giving you the right information. So, Christine, will you please save that one for me so we can answer later?
Sure.
Thank you. Okay, fine. Then also the prescriptions you may write and fax are prescriptions to be dispensed at a Veterans Administration facility, a military base, a Indian Health Services hospital or service facility, and once again, my computer likes to change IHS to his, so just so you know, it's Indian Health Services. And then any tribally owned clinic also can be written and faxed. What it's really saying is any federal facility you may write to them and fax. And I always suggest to people that if you are dealing with federal facilities, you want to call them and find out, will they accept an electronically prescribed prescription? If they will, that's fine. You should go ahead and EPCS it so that you have everything in the same format that you're used to doing it. Or you may find out that you need to write the prescriptions for those facilities. But I suggest that you find out from them. Also, prescribers may write and fax original RX schedules 2s for the following situations to be compounded. We just talked about that. For a resident of a long-term care facility, and also for patients who are enrolled in a hospice program licensed by the state of Arizona. Keep that in mind. It must be licensed by the state of Arizona, and you must note on the prescription that the patient is a hospice patient. Another condition where you may be able to write and fax is if the pharmacy management system or your system is not operational or won't be available in a timely manner, you have to indicate on the written prescription order that the EPCS system or pharmacy system was not operational. And you also need to maintain a record, a period of time determined by the board. We don't know yet how long that record would be kept, but I suggest you get a book and keep the record so you have it for when you need it. Of course, you have to write on the paper prescription if it was the EPCS system or the pharmacy system, and the time frames for which it was not available. And then additionally, you may write emergency quantities for Schedule 2s on oral prescription orders of a medical practitioner. It must be immediately reduced to writing by the pharmacist if they call or if you call and order a controlled substance manually. The pharmacist will immediately write it. Within 7 days, the medical practitioner, the prescriber, must write an emergency oral prescription manually for the emergency quantities described and deliver it to the dispensing pharmacist, or they could, if their system came back up, electronically prescribe the order and have it transmitted electronically to the dispensing pharmacist. Prescription orders for oral prescription orders for controlled substances cannot be refilled. You'd have to have another prescription that was electronically prescribed.
Just a question on that, Connie. Someone's EMR shows a C icon if the pharmacy accepts ERX prescribing of controlled substances. This says that it may write or fax. Does that mean we need to physically fax the script, or can we just write it and the patient takes it to the IHS facility?
Either way would work. Either way would work.
Okay.
But the point is you can fax it. It's probably a good idea to fax it if you have the ability to, so that the paper is not waltzing out your door with your DEA number on it. But it can be either way. Did I cover this one? Prescription orders for Schedule 2s shall not be dispensed more than 90 days after the date of the prescription. That makes sense. I think we all can understand that one. And pharmacies may sell and dispense Schedule 2 substances prescribed by medical practitioners located in other Arizona counties or in another state. And the reason this is in the mandate is because in the past, it was unclear of whether what county the practitioner was located in. Remember the original mandate was for larger population counties had to be live by January 1 of 2019. The smaller ones could be live by July of 2019, and now it just applies to the state. So there's no separate rulings around the smaller counties. The board-certified physicians, I'm going to cover a little bit on this because board-certified physician assistants have a bunch of several things that are changed in the mandate, the new mandate, the 2075 mandate House bill, because there were some errors in the original Senate Bill 1001. So, physician assistants may not prescribe without delegation by a supervising physician, board approved and DEA registered. So you have to be board approved to do it, you have to have a DEA registration, and you have to be supervised by a physician. The prescription privileges with delegation, you can do a 30-day prescription for Schedule 2, 3, 4, 5 controlled substances that are opioids and also benzos. You can do a 90-day RX for Schedule 1, 2, 3, 4, 5 controlled substances, and also for prescription only, the regular legacy. Also, board-certified physician assistant limits and regulations cannot prescribe medication intended to perform or induce an abortion. That's in the mandate to make sure that midwives are not prescribing abortion-inducing materials. A physician assistant cannot prescribe controlled substances more than 5 times in a 6-month period for a patient, for an individual patient. That doesn't mean you can only do 5 prescriptions throughout the whole 6-month period. It means for each individual patient. You cannot prescribe controlled substances that are opioids or benzos that are refillable without written consent of a supervised physician. So in other words, it must be a new prescription. You cannot prescribe prescription drugs refilled for a period exceeding 1 year. So in other words, you can't do a prescription drug that's refillable beyond a year. Again, for certified physician assistant limits and requirements, physician assistant must have completed 45 hours of pharmacology or clinical management drug therapy within the past 3 years. That is when you go to get your license renewed, or is certified by a National Commission on Certification for Physician Assistants. So you can do that either way. You also can issue a prescription order for controlled substances under your own DEA number. In other words, you can't write a prescription under someone else's DEA number. You must use your own. So if you don't have one, you cannot prescribe opioids. Also, you may not prescribe Schedule 4 or 5 controlled substances more than 5 times in a 6-month period for each patient. and you must have supervising physician's written consent to prescribe refillable Schedule II or III controlled substances that are opioids or benzos. May not prescribe prescription-only drugs to be dispensed, prescribed, or refilled for a period exceeding 1 year. And I've added a little bit in here. I normally don't cover anything for pharmacists in these presentations, but I've added this in because it affects prescribers as well as the pharmacist. So the pharmacist may dispense handwritten Schedule II controlled substances, including opioids, in the following cases. When the EPCS system is down, the pharmacist must record the system failure. The RX indicates that the medical practitioner who issued the RX provided care to a patient in, this is the federal stuff again, the Veterans Facility, military base, Indian Health Services facility, or tribal-owned clinic. And I put in a little bit about veterinarians. Veterinarians are exempt from EPCS until the state veterinary board lets us know that there are enough, there's enough software available to veterinarians that it would make sense to make them required to do EPCS. And also for the MAT exemption, the medication-assisted treatment for opioid addiction, prescriptions can be written manually. They are exempt. Let's look at the national landscape, what's going on nationwide. The good news, and I always like reporting this, so the SureScript's 2018 National Progress Report, and you might think, why isn't she doing 2019? SureScripts does one national progress report per year, and it's usually released in July of the following year. So in July of 2019, we received this information that the state of Arizona was 22nd, and we jumped to 11th place, and it was the largest rise in the country. We had the most people become compliant, which is great news for us, and we know that our prescribers are doing well in the state. This slide I'm not going to go over. What it really tells you is between the years 2016, 17, and 18, where we were percentage-wise in all prescriptions, non-controlled substances, as well as controlled substances. That might help you someday if you need to talk to some of your prescribers, but I stuck it in just so you'd have it. Also, this is a good one to talk about with your prescribers. Pharmacies enabled nationally, there are 96 of them. 96% of the national pharmacies are EPCS enabled. 99% of the Arizona ones are, so we're ahead of the game there. Prescribers enabled for EPCS, nationally there are 40 of them, 40% I should say. In Arizona we have 61%, so we're ahead by 21% of the national numbers, which is great to know. But we still have a long ways to go before we get everybody going. And it's very important that I let you know this. I just learned this the other day, that in July of 2019, half the states in the U.S. have EPCS mandates. What that means is vendors are going to be very busy, and it's urgent that you get in your vendor's schedule as soon as possible so that you're up, live, trained, and EPCSing by January 1 of 2020. I am told there will be no waivers or exemptions. You just will not be able to prescribe Schedule II controlled substances that are opioids. Another very important part of the controlled substance is the prescription monitoring program. Actually, the prescription monitoring program was put into place, as you can see in this blue box of the slide you're looking at now, beginning on October 16th of 2017. That is when prescribers are required by law to check the PMP, the prescription monitoring base, before a prescription for opioids or benzos are generated. So that's so that you can help find doctors, shoppers, all those kinds of things. And you can see what the person you're prescribing for has been given in the last year. The Controlled Substance Prescription Monitoring Program, in a nutshell, this is what is required. We do, I should let you know that we do a complete webinar on the Controlled Substance Prescription Monitoring Program that you might want to sign up for. Lynn Curtis from the Board of Pharmacy does it. He does an excellent job and teaches you how to use it as well as know about it. What I'm doing here today is just giving you what you must do, not how to do it. So you need to go and review the past 12 months of your patient on the PMP before prescribing. And exceptions to reviewing the patient's record would be that medical residents may register using the hospital's DEA number and appropriate suffix. Prescribers must register also to use the prescription monitoring program. And it is important to note that it doesn't mean once you start electronically prescribing controlled substances, it means any time, whether manually written, like if you're still manually writing right now, you are required by law to check the PMP.
Quick question for you, Connie. Since nurse practitioners do not require physician supervision or collaboration in the state of Arizona, which mandates apply to the nurse practitioners?
I would say that you need to look at 2075, look at the House Bill 2075. I did cover some of that in this webinar, but I suggest that you look at House Bill 2075. There's a whole section on physician assistance. And then if you still have questions or want me to do any research for you, give me a call and I'll be happy to do it.
Thank you.
There are, back to the Controlled Substance Prescription Monitoring Program, there are 3 different ways that you can access the PMP. One of them is via the Board of Pharmacy website. The Board of Pharmacy has some pretty neat videos and how-tos on their site, so you might want to go there, register, and take a look at what they have available online. And you can go and do your checking of the PMP via their site. You also can do it via many of the electronic health records, your EHRs, will offer you the ability to do it directly from your EHR system. And then also those of you that are members of the Health Information Exchange, HIE, you can do it through the HIE portal. A little bit about the campaign. The Click for Control campaign, as I said at the beginning, is a committed collaboration between Access, the Board of Pharmacy, Health and Human Resources, and Health Current. And what we've done is we've created a bunch of resources for you, put them out there on the Health Current website so that you can find them and look and see what they are. There are a lot of fact sheets out there that you can look at to get started, and sometimes I suggest that you print some of those out and share them with your prescribers. That will give them a little bit of heads up on what's going on. There's also information on future and upcoming web presentations. We have articles sitting out there. We do a newsletter. We're available to do in-person EPCS presentations for like conferences. I did one a little while back for I think what the name of it is. It's for the surgery centers. I think it's the Arizona Surgery Center Association. I did one for them and lots of other ones throughout the year. I'm available to come and speak at your staff meetings or any company meetings that you might have, and I'm willing to redo my presentation to meet whatever you're looking to have announced. Then I also can provide to you slides to put in any scheduled presentation that you might want to have, and I appreciate you doing that because that helps us get the word out. And then we do provide free support, phone-based assistance. So you can call me or some of our other folks and ask questions. We can get the answers and help you research it. And also email communications. Send me an email and I'll happily answer you back. And my mode of operation is if you call me and ask me a question, I'll answer your question. But I also send you an email back so that you have it in writing as well. Some other things that are on our website, individual flyers that you can print and use. And I put a little slide in here so that we can make sure everyone understands that Dr. First will be demonstrating for the next 3 webinars that we'll be doing, this one plus 2 more. And Dr. First is an excellent company that also has a smartphone operation, so you'll be excited about that. I see a lot of folks wanting to use that for surgeons as well as dentists that do extractions at other dental offices. Here's the next webinars that are coming up, the today one, and then we're going to do the controlled substance one is on the October 30th, and then the written and electronically transmitted prescription requirements will be done on November 20th. I'm going to let you have this slide to review so that when you're talking about what are the benefits, probably the most important thing as far as I'm concerned for this is the Promoting Interoperability Program Meaningful Use Measures, and also that measure of electronic prescribing for the MIPS program, those of you that are involved in that. I'm not going to talk about my closing remarks because I do want to tell you about the 2019 Health Current Summit and Trade Show, as well as the 2019 HIE User Group Meeting. The User Group Meeting is free. There is a fee for attending the 2-day Summit and Trade Show. We usually have about 300 people, 300 to 350 people that attend our trade show, and we already have about 200, is it, Christine? Yes. Signed up for the User Group Meeting?
Yes, over 200.
Over 200 already signed up for that. So I also wanted to tell you that if you are a PI participant, if you were a Practice Innovation Institute participant, you can get a special rate. It's $25, which is $129 to $159 value. So if you are a PI participant or were a PI participant, please make sure that you use that. I also want to have my disclaimer in here. The webinar is intended to educate and help you understand and navigate the adoption of EPCS, but I always encourage you to interpret the legislation for yourselves so that the mandates are met based upon your specific situation and needs. So here's my contact information so that you can sign up, call me, go to our webinar from that information. And Christine will be sending me the slides out to you, and she's recording it, so you'll have it for that. And that is the end of mine.
Thank you, Connie. It doesn't look like we have comments at this time for Connie, but if you do have additional comments, please use the chat feature, and we'll have Connie stay on the line to answer those as well. In addition, I would like to turn our next presentation over to Eric Zitbaum, who is the Electronic Health Records or e-prescribing manager at Dr. First. Let me just change the role here to see if we can connect to Eric.
Perfect. And can you hear me?
I can hear you. I was just making sure I had your line unmuted. But I cannot see your screen yet.
Bear with me.
Oh, it's coming up now.
Okay, good. Can you see that?
I certainly can, Eric. Thank you so much. I will turn the presentation over to you. I will monitor the chat box as well, as we will continue to have all lines muted. And would you like me to wait till the end for questions, or as they come up, if there's an appropriate area to ask them all?
Frankly, I'm happy with either, so whatever works.
Okay.
I'm flexible, so thank you. My name is Eric Zitbaum. Been with Dr. First for over 6 years. I have been working with states since the beginning regarding these e-prescribing mandates, so very familiar with the pain that you're currently going through. The state saying you have to do the e-prescribing, and it might be a workflow process that you're not necessarily familiar with. So I'm just going to show you the basics of essentially what it means to e-prescribe. send these controlled medications, what it looks like, etc. It's a lot of pointing and clicking, very easy to do. What you're viewing now is the web access. So you're logging on via your PC. This is what that would look like. You have the same flexibility of sending prescriptions, controlled medication, viewing med history, and you can do that via an app as well, as Connie had mentioned. So you can accomplish that kind of thing on the go via your phone and that kind of thing. So just to kind of review quickly on what exactly you're looking at, excuse me, you have got, when you pull up a patient page, all the information is going to be just on one screen, so you don't have to flip around necessarily. You've got the patient demographics starting at the top of the page here, so just basic info on the patient, pharmacies they may go to typically, and then if there's any kind of formulary information. That is not for billing purposes. It is to make you aware, does the insurance company cover that medication? If not, we will provide a generic alternative, and those kind of things pop up for you. It's you know, very intuitive in terms of how that would work. Scrolling down here right in the middle of all of this and the bulk of the screen is the active medications. So this is going to be medications that are being taken by your patient. It'll be prescriptions you're providing and then anybody else they may be seeing. So we are pulling that information. We're doing that in real time, and so it makes it nice and easy for you to view the medications they're currently on. It will probably occur as I'm doing the demo. A lot of this was intentionally done to provide you essentially for alerts, whether it would be drug-to-drug interaction or drug-to-allergy interaction, that kind of thing. So what I will do now, so we got the medication history, the active meds. Below, you can enter things like allergies. You can add that in. You can add diagnosis. If it's relevant, you don't have to put it in there. It's simply just for your information, help you with the prescriptions. So that's what you're looking at. Pretty straightforward. So what I'm going to do now is simply, I'll show you how to actually prescribe. 3 ways to prescribe. The first one I'm going to do is, because this is probably what you'll be doing most of the time anyway, and that's frankly renewing a prescription. You can pull the legend medications, but since the bulk of this is really regarding controlled meds, I'll show you how you do the EPCS of this. So what I'm going to do here is let me click on this. So oxycodone, 5 milligram. I'm going to renew it, so I check mark that box. I'm going over here. I'm going to renew the medication. What this is now going to do, let me back up. Here are some of the alerts that I indicated. They will pop up. You have the discretion to prescribe anyway, which you can see this button here, but these reminders will pop up for you. I'm going to prescribe anyway, and now what will occur is this prescription is now at the bottom of the screen. This prescription is pending. I will show you later what you can do in terms of workflow, but this is nice because you can have staff essentially load demographics, queue up medication. The provider themselves can have as little involvement as just simply releasing these prescriptions at a later time whenever convenient. I'll show you what that looks like. But for this, I've now got the oxycodone here in the pending area. I'm going to click send. If this was, let's say, that amoxicillin you see up here, it would go to the pharmacy once you click send. Since it is controlled medication, we have this extra step here, and this is probably where you have heard the term two-factor authentication. This is where this comes into play. Essentially what we're looking at is the script you're going to send over. I'm going to check mark this box. I'm now entering a signature passphrase. So this passphrase is something that you create in the beginning when you get set up. We hold your hand and walk you through this process. It's pretty basic, but it stays the same. It's a static passphrase, so let me enter that in. And then what I'm going to do is enter the token PIN number. It's a 6-digit number, and bear with me. What I'm actually doing is I'm logging into my iPhone now. I'm looking at my app. It is providing me at this time this token number of 838025. I'm going to click sign, and now the prescription is going to be sent to the pharmacy. So it tells us that the controlled substance prescription has been sent, and then I can view up here and I can actually see that my name is listed as the prescriber. The last date was written as 10/16. So now this prescription has been renewed and the active medication history has been updated. So that is how you send a controlled med. I'm going to show you this a few more times, but it is very straightforward. It's a lot of pointing and clicking. So that is how you would renew a prescription. You can set this up as well and create favorites. The medications that you do most often, associated with the dosage amounts, types of medication, frequency, etc. You can set up the favorites, as you can see, as organizational. So if you've got a big practice, you can do practice favorites, your own personal favorites. You can then go back to recent. So, and then we simply, it's the same type of idea of we click on. So what I will do is for an example, I'm going to click on this Adderall. I'll click prescribe anyway. Now going to take me to the signature screen. It's wanting me to enter the information, and this is good because I was going to show you this next. And this is just essentially the prescription pad. So you're just going to set up how you want to send the medication or how the prescription should look. Everything's in these drop downs. So I'll put information in there. You can put information in for directions to the patient, so you can free text. You can put in directions strictly to the pharmacist. I'll just click X a few times to give you the example. I'm going to review this. And here's the prescription. Nice, legible. Here is the information that was going to the pharmacist. Directions to the patient. It might look a little different based on software on the pharmacy end, but this is what they're seeing on their side. I'm going to pen this prescription. We're going to go back to the main screen, and I'm essentially going to go through those steps again. Let me just show you how to send this EPCS prescription. So we're down here at the bottom. I then can click send. I'm going to acknowledge it with a check mark. I'm going to enter my passphrase. I'm going to enter my token. Bear with me as I log into my phone. And so now I've got a new token number. This will refresh every 30 seconds. I'm going to sign. And it's giving me an alert because I had prescribed the Adderall earlier. So I can stop, I can keep. I'll go ahead and keep it. I'll continue. And now we've actually got duplicate medication, but it's showing up in the med history. So for purposes of the demo, that's why I want to show this. And then shows it was last written 10/16. So that's how you would pull from your favorites. And then you can create a new prescription, so you can start from scratch. Same idea. I'm just going to type in here the medication, and then, you know, it's got the smart SIG type information, and it will start to pull up as it recognizes the name of the medication. I'll pull whatever dosage amount I want. Go through this. It's going to take me back to this signature screen. I'll show you this again real quick, not to be redundant, but just simply to show you, you know, what this looks like. Everything's in these drop downs. Let me do this. I'll do 60. We will skip the instructions. I'll click review. I'm going to pen this. We're going to go back to that main screen. Now, like I said, in terms of workflow, you can have staff do this. So you can see the patient, have staff queue up medication, and then whenever is convenient for you, you can go in and then release that medication at any time. Non-controlled medication, you can release in bulk. Controlled medication, you do have to enter the token number for each prescription sent. Now, if you have a patient that has multiple controlled medication scripts that you are writing, if it's 2 or 3, whatever it may be, the same patient, you can do that in bulk, enter the token number and passphrase. But just so you understand. And just for the sake of just showing you what the heck it looks like, I'll do this again. I'm going to enter that passphrase, and I'll enter the token number, which is right here, so 895616. Click sign. I'll get my little message indicating that I have done this before. I'll go ahead and stop it. I'll just click continue. Take us back to that same screen, but now you get the idea. It's very straightforward on how you would send these prescriptions. Couple of items. I mean, there's all sorts of bells and whistles that we do have incorporated in here. There is e-prior authorization. We have what's called My Benefit Check, so that will pull up all the pharmacies that a patient may see and allow you to view the dollar amount of that prescription. So you can steer them in the right direction where the prescription medication may be the least expensive.
Eric,
oh, sure.
I apologize, Eric, excuse me. We do have a couple questions coming in that I thought you might want to just chime in on as well.
Sure.
The first question is the system for those clinics whose EMR doesn't offer a way to EPCS?
Okay, so with an EMR, yes, if your EMR is only doing non-controlled medications, you can set this up. In terms of our product, you can set them, in, other e-prescribing, you can use a standalone product alongside of your EMR. That is fairly commonplace. A few years ago, where not many people had EPCS, that was very common. People would use us alongside their EMR. In terms of connecting with the EMR, yes, functionality-wise, we're connected to well over 350, 400 plus EMRs, so we can do that. The logistics of it, the EMR needs to allow for that connection. So some do, some don't, but the functionality is there. So in terms of workflow, we can incorporate it into your EMR so it all looks and feels like it's all the same thing. Worst comes to worst, if you just need something to get you through the initial pain until your EMR is up to date, you can use this as a standalone alongside of your EMR and send the prescriptions. Okay.
And how does the medication history and prescribing information get from this system into the clinic's EMR? So I'm assuming that's the Dr. First system into the EMR.
I gotcha. So with the 2 ways this is going to happen. We are ultimately connected to SureScripts on the back end. So when you enter patients' demographics, in real time, we're pulling this information. We work with a lot of PBMs. SureScripts is ultimately the source of truth on the ambulatory side with med history. So we're pulling that patient information from there. If we can connect with your EMR, we will simply push the information into your EMR. We can connect it to the patient, dump it in the SOAP notes, and it's nice and easy. If your EMR, can't connect with us for whatever reason, but they have a connection with SureScripts, they can be pulling that med history from SureScripts and update it that way. And then kind of the last resort is you can take a screenshot of the prescription you've sent and put it in your notes. Got a lot of doctors that have done that over the years. So not the greatest resolution, but you can do that. So push come to shove, if you've got to do something, you can take a screenshot, like I say, and then throw it into the notes in the EMR.
Okay.
So those are kind of the few options.
Just a couple other quick questions for you, too. It does appear that if it is, Dr. First is a standalone, does Dr. First maintain patient demographics in your system?
Yeah, yes. So the demographics and all the information from the patients are being stored by us on our servers, redundant at different locations. It's not a third party storing our info, but we will store the demographics and patient med history. I did see a slide earlier commenting on essentially in case of an audit or whatnot, we can pull that data for you if need be.
Okay. And are you able, or is Dr. First able to provide an EPCS prescription report function as a standalone product? And the other question, second part of that is it a purchase of a larger product required, or what is the cost even associated with the software? That's kind of a multi-part question.
Right, yes. No, there's a few things, but no, in terms of reports, yes, within your basic subscription of the software, there are certain reports that you can pull from your side. There are some different things on our end that we can create, let's say a report on a monthly basis via an Excel spreadsheet. There's a cost associated with that, but that's typically, very large multi-location ambulatory groups. A lot of people will just simply pull the reports themselves out of their Arcopia software, which you can do. In terms of just a general idea of cost, this is not very expensive. It's a few $100s per year, and it's based on an annual basis. So it's to give you kind of just a rough ballpark. So this is not something that's several $1,000s a year kind of thing. It's based on providers and prescribers, people not prescribing. You can have basically unlimited staff work within the software. There is no cost associated with that. The only thing you're paying for is people who actually have to essentially have their name on the prescription.
Okay, wonderful. I know, David, you have another part to your presentation here, but just two more quick questions for you.
Sure.
Is there a discount to the National Association of Free Clinic members?
That in particular, I don't think so, but we do have discounts set up with Health Current. So we do recognize that, and we do have a discount associated with that. Frankly, that's probably going to be the best discount. So I would say when you call in, you'll be talking to somebody on a member of my team. So you might talk to myself. There's another gentleman by the name of Eric as well, not to confuse you. He handles Arizona in general, but we're aware of that. If you just say, hey, I'm working with Health Current or figured, discovered you via Health Current, we apply that discount. And that's going to be your best price point.
We seem to be going down the cost here at this point. Is there a cost per physician, or is it per clinic?
It is per physician. So if it's one doctor, 3 locations, you're just paying for the one doctor, and then you can enter all 3 locations into your login. And then essentially over here on this right-hand side, up in this upper right-hand corner, there's a drop-down that you would click on. It would then give you a list of your locations. So then you can pull up that location, and then you're pulling the patients from that location from there.
Okay. Just one other quick question for you. Is there a PMP link in the Arcopia?
Yeah, I was going to go into that next, and
okay.
Yes, there is. So we do provide that. Yes, so there is a connection that we do provide, and I know cost is top of mind. There's an initial cost to connect Arcopia with the state PDMP. It is a one-time cost. There again, it's a few $100s. The annual licensing fee of all of that, though, is covered by the state of Arizona, so you're just paying that one initial cost. what that looks like, I don't have it in my demo account, unfortunately, but essentially what happens is you will have the EPCS script will pull at the pending area. You're going to have a check mark box basically right in here where you can click it and say that you want to check the state PDMP. And then essentially what happens is a box will come here. It will be essentially the interface, the screenshot of the state PDMP. You can acknowledge that you are basically checking the state system, acknowledge it through our Copia, and then you can send the prescription through the screen. So everything will be on one screen for you. And then you get credit by the state for checking into the state PDMP system. So hopefully that answered that.
Eric, does the Recopia log when providers check in the PMP or report if audited?
From the PDMP side, you will want to pull reports. You're going to want to go into the state site to pull an actual report. If you get audited saying that did you acknowledge the state PDMP site, at this time, you will need to go into the state site to pull that report. We're working to get that kind of stuff, but yes, at this time, you got to go into the state site to get that report.
Okay. So it's recording when you went to the site, and then does it also record it into the EMR, or is it just only at the state level?
Well, from our end, what we're going to do is record the prescription, the history of the prescription itself, and that it was sent. If we're connected to the EMR, we'll send that prescription back in to the EMR. However, the acknowledgement of the PDMP system, while you can do it within our Copia, yes, if you need to show proof that you were going into the state site, that's going to be via your login into the state PDMP.
Can you tell us a little bit about how the pharmacy database is populated? Does the provider have to upload the pharmacies, address, telephone numbers, et cetera?
No, all the pharmacies are already in there. And it's the same kind of thing. You're going to point and click. So this will pull up the most common pharmacies, and then you can go in and do a pharmacy search. Mail order like Express Scripts, all of that kind of stuff is in there. So everything is in there. All you're going to do is point and click on the pharmacy you want.
Fantastic.
So Eric, I have a lot of folks, this is Connie speaking, I have a lot of folks that were very interested in your smartphone application. Are you going to be covering a little of that?
The demo account is not working properly. What I can do, though, is I can send a video that we can pass on, and I do apologize. But I've got a very brief video, essentially 60 seconds, shows you what it looks like, how it works. Similar functionality in terms of it, you're going to scroll through, tap on the button you need, and fill out the prescription that way. But I can pass on a video that you can pass on to the attendees. So,
perfect.
And next time I'll have something ready.
All right, perfect. That'll work great.
Okay.
That's all the questions, so you can continue on. If Christine, do we have folks on the line yet?
We still have folks on the line. We're just a little bit past our time. Eric, do you have a lot more to share?
Frankly, that covers the bulk of it.
Okay.
I mean, I just was going to point out that, you can pen these prescriptions, and then later you can go to this pending prescription area and simply just click on all of those and then release the prescriptions accordingly. And then you can get pharmacy fill requests. Now, obviously, controlled medications, I got to come back and see you. But if you're using this for non-controlled medications, the pharmacy can send refill requests, and you'll see that in these icons. But that was the other two comments I really just wanted to point out in terms of workflow and functionality.
Wonderful. And if folks have other questions, is in your PowerPoint, is there contact information for you as well?
Yes, and then I can send that over. I believe on the invite there was something, but I'll get something over to you. And then I'll get you direct emails and extensions for myself and the other Eric, so we'll be available.
Wonderful, thank you. The chat box is still open, so if there are additional questions for Eric at Dr. First or Connie at Health Current, we'll remain online for just a few more minutes. I know we're past our time at this Lunch and Learn session. Thank you all for joining us. Today's session was recorded and will be posted up on the Health Current website along with copies of today's presentation. We will pause here for a moment and see if there are additional questions coming through the chat.
Eric, will you have a minute or so to talk if I call you after this call?
Sure, yep, I'm here.
All right.
At this time, I've not seen additional questions come through, so thank you again, Eric, for joining us, and thank you, Connie, for kicking us off today on the EPCS. There are additional webinars that you can sign up for e-prescribing. Please visit our website at healthcurrent.org, and thank you again for joining us today. Have a wonderful afternoon.
Thank you.